We are back now with Dr. John Kressel of Phoenix Cyberknife, and he brought along a patient. This is William Guthrie. And I want to start with you, Dr. Kressel. What brought William to see you?
Well, when he first came in, he was just looking for more information as to kind of what some of his treatment options were. He had been gathering ideas about treatment after he had his diagnosis for prostate cancer. So he was trying to figure out, what am I a candidate for, and then what should I select?
Right. You said he was age 1. Mm-hmm. And so, William, you found out because you were applying for insurance.
I was applying for some life insurance, yes.
Okay, and what happened?
Well, my PSA came out much higher than what it had been a few weeks prior, and so we started the quest to find out.
Right, and you had always been checking your PSA. You
always.
had a physical.
Yep.
And when you found out the why, what was your option?
Well, we had to figure out what we were going to do to treat it.
Right.
And so we started going to urologists and having different urologists giving us different answers, and
And you got more than a second opinion. You got a third.
Four.
You got a fourth opinion.
Fourth opinion.
And then why did you decide Phoenix Cyberknife was the right treatment option for you?
I think because of the accuracy of the machine and the time commitment to it was mostly what it was. The 5 times for 48 minutes was way better than 9 months or 3 months of 5 days a week.
Because what were you originally told? You were originally given an option to treat the prostate cancer, and what were you told would be the treatment?
There were 14 treatments, as I remember at that time, and surgery wasn't one of them, but radiation was, and so it really boiled down to the Calypso machine or the Cyberknife machine.
Right.
And my wife found Cyberknife on the internet, and we went and talked to Dr. Kressel, and it's pretty much history after that.
Yeah, what was that first exchange like? What did you think?
It was pretty emotional, to be honest with you, because you want to make sure you get this right to start with, because you only have one opportunity to do it right. Mm-hmm. And so Dr. Kressel visited with me and took all the time and let me know what my situation was and what we needed to do. And so.
And how long was his treatment?
So his treatment were 5 treatments, 5 days in a row. Each treatment was about 45 minutes, done as an outpatient.
Can you believe that he said 5 treatments, 5 days?
Yeah.
And you were originally told several months.
Correct, yeah.
Were you thinking this is really working?
No, I knew it was going to work. We'd done a lot of research prior to going in, and we pretty much knew exactly what the outcome of each different kinds of treatments might have been.
Did you have any side effects?
No.
No side effects?
No.
Is he cancer-free?
He's coming up on 7 years with no evidence of cancer, yeah.
Wow. Do you recommend Cyberknife? To
anybody, and even without prostate cancer, I recommend that people talk to Dr. Kressel about their cancer, because I think non-invasive is way better than surgery.
A lot of people would agree. And Dr. Kressel, what makes your physicians and radiation oncologists different?
Well, again, it has to do with training and experience. Somebody who can only really provide you a discussion with your treatment options needs to be somebody who's familiar with it. If somebody isn't trained or board certified with regards to that type of discipline, and in particular Cyberknife, they may not be able to provide the accurate information as whether it's an option or not.
All right. Well, William, 6 years and counting. Congratulations.
Thank you.
We'll continue to keep you in our thoughts and prayers. If you have any questions for Phoenix Cyberknife and Radiation Oncology Center, you can email them at info@pcroc.com. They are located at 4611 East Shea Boulevard. That is in Phoenix. Give them a call, 602-441-3845, or visit them at phoenixcyberknifecenter.com.